This study is quite interesting because it aims to assess whether age at onset has an impact on MRI metrics in multiple sclerosis, which is quite interesting because every day we see clinical differences in patients, in younger patients compared to older patients, and there's also a lot of debate in the MRI, in the MS clinician group on whether disease-modifying treatment should be the same for younger patients. Treatment use should be the same for younger and older patients. So in this study, we used a pseudo-longitudinal approach. So we combined what were actually cross-sectional data in order to have, after removing the physiological effects of age and sex, in order to produce a correlation with disease duration in both pediatric onset and adult onset MS patients, thus spanning a very long disease duration period, which is quite difficult to otherwise perform with an actual longitudinal study, because the time span was over decades. And MRI techniques continue to evolve. So what we found was that pediatric patients developed white matter damage in terms of reduction in fractional anisotropy earlier than they developed gray matter volume loss, and also that at the beginning of the disease, brain damage is actually, in terms of white matter integrity loss and gray matter volume loss, is actually less severe in pediatric patients compared to adult patients, when on the other hand, they usually have a higher lesion burden in the brain. We also compared these MRI data with clinical data, and we found that atrophy microstructural damage to the white matter was found to anticipate clinical disability, which was found to occur almost at the same time when significant gray matter atrophy ensued, and that we then hypothesized that there might be several compensatory mechanisms that prevent the brain from developing gray matter atrophy in response to white matter lesions, and again, clinical disability in response to gray matter atrophy.